So while we're waiting, Dr. Shala, maybe you can tell us about your experience with the fibroid embolization as a alternative and the most fertility-friendly minimal invasive treatment of fibroid disease.
Sure. Thanks for, of course, but I could start by just telling a story about this afternoon where I saw a patient who I treated about 6 months ago, and she was like a different person actually, and she couldn't stop talking about how amazing it was, how she had lost hope beforehand, and how much better she feels. Her stomach is down and she's not bleeding anymore. I mean, it was just amazing. I thought it was so appropriate that the day ended with my last patient being this 6-month follow-up. It reminded me how amazing the procedure is and how life-changing it really is. I mean, she couldn't stop talking about how everything she said was something else that would dramatically affect a person's life, but in combination, it's really a lot. The bloating, the bleeding, just not feeling like yourself, the anemia, which causes you to feel exhausted. And then to rid somebody of all that with a simple procedure that takes less than an hour is just amazing. It's really amazing.
And what typical symptoms do you see of fibroid disease when patients come to you?
Well, the most common symptom, Dr. Yan, is that heavy bleeding. So most women are, severely bleeding when they come to us with all kinds of levels of anemia. That would be the most common one. But obviously, there are other symptoms that are related to the size of the uterus. It presses on the bladder. People have problems peeing a lot. There's problems, and then there's infertility. There's a whole slew of secondary symptoms that are related to the size of the fibroids.
How do you think girl can or woman should differentiate between a normal menstrual period, normal bleeding, and abnormal one?
I mean, that's an excellent question. I think that, women know their bodies very well. And when something changes significantly, you're used to using 2 pads a day and all of a sudden you're using 10 pads a day, that's a lot of change. And so, that's why we ask those questions sometimes as to how many pads you go through a day, and it quantify how bad of bleeding people are going through. So if you have a sudden change in your bleeding pattern, that should warrant an examination. It's very simple, quick little ultrasound, doesn't hurt. It's simple, painless, quick, and easy. And we find out, if you have a problem or not.
And in some women, I've seen that many women describe the process as gradual. Hello, how are you?
I'm good. How are you doing?
As a gradual worsening of the problems. And I was suggesting a woman just to think about, what to differentiate what is disease and what's maybe difficult but still normal, whether it limits the ability to function. If someone functions very well, it's one story. But if a prolonged heavy menstrual period that lasts a week or 2 weeks really limits the woman's ability to function and go out or go to work or study or sex life or anything to function properly and normally, that's a sign of disease that needs to be taken care of.
Right. No, I think you're right. There's a lot of different symptoms, and because the evaluation is so easy, if you have a slight concern, don't wait till it's too late. I know it's something maybe we'll be discussing a little bit later, hopefully. So yeah, it's pretty easy. As Dr. Yan said, there are a lot of reasons why you can be evaluated, and it's quick, easy, get to the bottom of the problem.
Hi, Shay, how are you?
I am good. Today has been very productive. We're here to message and to inform people about fibroids. And I know you brought me on to talk a little about the story. I'll make it really, really quick. I never heard of fibroids before. First time I heard of it was when I went to the doctor. It took me almost a year to go to the doctor because I never heard of the symptoms before. I didn't know what it was. I had constant urination because clearly the tumor was pressed against my bladder. I had extended long menstrual from a normal 7 days to 14 plus days. I had back pain, pelvic pain. I had all of the symptoms that came along with fibroids, and that's not for everybody. We know that some women, they have fewer symptoms than I do. I just have that case. In my situation though, out of my pain came a beautiful situation, a brand called The Healthy Hand I started, and I was able to introduce what I use to help me with my symptoms with fibroids, which was herbs. So the herbs help minimize all of my symptoms. And throughout that entire process, I never heard of UFE. No one mentioned it to me. The doctors never said anything. My options were myomectomy or hysterectomy. That was it. It amazes me now because I wish I was pregnant with that opportunity. If I was, I would have went with that option. But because I didn't know, I was unaware, I had a myomectomy done. And for those of you that don't know what a myomectomy is, it's when they remove the tumors off your uterus. And fibroids are but that grow on your uterus. So that's what I did. So now I have a cut that I can never get rid of. And if I want to have a child during childbirth, I can't have a normal vaginal birth. I have to have a cesarean done. I don't have that option anymore. So with fibroids, I think that it's a beautiful thing that we're coming together to bring awareness towards the symptoms and options so women don't end up in the same situation that I was in. Minimum options with minimum information. So this is a great thing. Glad to be the face of fibroids. So let's talk more about it. That's a little bit about my story.
Hello, Dr. Shiloh. Hello, Shay. Hello, Dr. Yan. I'm Dr. Kimberly King. And I'm also one of the brand ambassadors for the USA Fibroid Centers. I'm so happy to be here, and I do apologize for each of you for logging on. I see we are here in large number, and so the ladies are definitely very interested in knowing more about fibroid disease. I'm happy, like Shay, to be one of the faces of this amazing, amazing organization. And I'm so grateful to be able to share my story and my truth and to be able to partner with you all to help someone else. As we are embarking upon, I think, our third or fourth Talk About You series, so many women have inboxed me and just to share their heart about everything they've experienced through their fibroids and what, if they have fibroids, what do they look like? How do I know I have fibroids? And so I'm glad that we are here tonight to answer some of those questions. Just for those of you who are just jumping on, who do not know who these wonderful people are, who I am talking to tonight, I do want to do a formal introduction of them because I do believe that honor is due. And I want to start off by introducing not only myself, which I've already done, but I also would like to introduce Shay Johnson, who is an actress, a model, and a fellow fibroid ambassador. Shay, thank you so much again. Of course, Dr. Yan, who we love dearly, who is the USA Fibroid Center founder and CEO. And also, we want to welcome Dr. Arent Shiloh, who is the Director of Fibroid Services at the USA Fibroid Centers. So you guys, we have some heavy hitters amongst us tonight, and we are in good company. So I know that you guys are going to be helping us to just kind of, navigate through some of these trials. And I heard you guys before while I was fumbling with the phone, just talking about some of the early warning signs of fibroid disease, which so many women are unaware of, not really knowing. We just assume that we're just in a heavy period, a long period, a complicated, complicated sex, it's too hard, it hurts, just different things that, we just don't know. We just assume that these are, this is the hand that God has dealt us, and we just got to deal with it. I want you to just please, Shay, I just want you to talk about a few of your early warning signs that you experienced and how you first found out that you had fibroid disease.
The early warning sign, the extended menstrual, that's when I first noticed there was an issue. It wasn't I didn't have a lot of pain in the beginning. It was just my menstrual went from 7 days into 9 days, then to 11 days. It just kept going up. Then I would have 2 menstruals in 1 month. That's not enough. I started going to the restroom constantly because I didn't know there was against my bladder. I also had miscarriage. I believe I've had for years, and I believe that was the reason I had a miscarriage. But because no one talked to me about it, all of the different symptoms that I had to deal with over the years, I didn't recognize anything. I thought this was normal for all women. I'm just having different, my menstrual was off. But when I went to the doctor and I found it wrong, all of my symptoms were specifically from fibroids. And that's why I feel important that I speak up on my situation. There are a lot of women like me. You could be having menstrual right now because of fibroids, and they can easily be removed. UFE. So those were the beginning symptoms, and the same exact symptoms were and worse every month. Unfortunately, my tumors grew. I had one that was the size of about 2 grapefruits. So.
Wow. Yeah, I can definitely relate to that, Shay, because like you, I had really large fibroid tumors before they were all removed. I had 14 in total. 2 were the size of grapefruit as well. 3 were the size of golf balls. And I looked like I was carrying a baby. Like I looked like I was several months pregnant until I got them removed, unfortunately, by way of a hysterectomy. But I do remember having the heavy periods. I do remember having long periods. Like my periods were, I don't know, it went from anywhere. It started with 7 days. I've always had a 7-day period, even as a young adult or a teenager. And then as I got older, they went from 7 days to 10 days. And by the end of my bout with fibroid disease, they had gotten up to about 21 days where I was bleeding 3/4 of the month. Most of that time I was bleeding and I was clotting. So I was, large clots were, I was seeing large clots, on my pads. I was going through probably, I don't know, maybe a half a box of pads every couple of days. Like I literally was going through, I know during a period, I probably used maybe about 3 bags of pads.
That's
just, it was totally an investment for sure. The tampons weren't even an option for me. Let me just say that tampons were not an option. They just did not hold, the amount of blood that I was losing. And it wasn't until I passed out in the garage that I realized that I had a serious problem. I went and got my levels checked by my doctor, of course, by the doctor in the emergency room. And that's when I was told, and I don't know what your levels should be. I don't know the numbers, and the doctors can probably tell us better. But I just remember the doctor saying, I am surprised you're still alive.
Wait, are you referring to your hemoglobin levels? What levels?
My hemoglobin levels. I don't know the names of the levels. It's all a fog to me because remember, while you're losing blood, you're foggy.
Are you anemic now?
No, I'm not.
I'm highly anemic. I eat ice all the time, and I stopped the pills they gave me because they made me constipated. But when I started to take moringa, it made me much better than what I was. But I became highly anemic because of fibroids.
Yeah, I actually have been. My hormones are definitely different, but I don't want to get ahead of ourselves. I just wanted to just kind of talk a little bit about some of the symptoms that I noticed from just being, stricken with fibroid disease and just not telling anybody because I just figured I just had a heavy period, and that, it wasn't until someone said, it's not really normal for you to be clotting like this. Like you shouldn't be passing this size of a clot monthly. Like it looked like it was literally, this big around, you're passing these large clots. And I know this is maybe TMI for somebody that's watching. If you're tuning in, thank you for watching the US Fibroid Centers. I'm Dr. Kimberly King, and we have Dr. Yan, Dr. Shiloh, and our other brand ambassador, Shay Johnson, here just talking about some of the signs and symptoms of fibroid disease. If you are suffering from any of these things, we definitely urge you and encourage you to reach out to the USA Fibroid Centers, and you can do a virtual consultation. I wanted to just interject that for those that are just logging on, because I see that there are people coming on and going off and want to make sure that they're understanding what we're talking about. And so, yes, some of these things are definitely signs, and I want us to talk a little bit about that with Dr. Yan. I want you to tell us, Dr. Yan, are there any other signs that we should expect if we do have fibroid disease?
So a common theme between what you described, your disease, and Shay, was normalizing abnormal, not realizing that it's a disease, and things progress slowly, even to ridiculous symptoms, and you still didn't know that it's a disease, like having bleeding that continues and getting worse and worse and worse. Anemia. People take iron pills like a vitamins, thinking that it's normal, everyone has it. And the fact that many people suffer up to 80% by age of 50, by up 60% by age of 40 of Black women suffer, or 26% by age of 30 suffer from fibroid disease, doesn't make it normality or sign of health. And in addition to heavy bleeding, as Shay mentioned, small bladder symptoms, it's not because the bladder is small, there's no such thing. It's just because you had a pressure from the tumor, fibroid tumor, and constipation can be from present fibroid tumor. But the worst symptoms that you experience, a tragedy, is a miscarriage. Fibroid is the #1 reason for miscarriage, for spontaneous abortion overall.
So you wait that again? You said fibroids is the #1 reason for miscarriages?
For miscarriages, for spontaneous abortion.
I didn't know that. I knew we had miscarriages from fibroids, but I didn't know that was the #1 reason. I did not know that.
And many patients just realized after that, oh my God, I had a miscarriage. Now let's see what's going on. They get ultrasound, and then we'll learn that they have a fibroid disease. And it was interesting what you mentioned, and one of your discussion previously, that's not even only physical, but mental symptoms, feeling depressed,
Yes.
bound to disease, inability to function affected your life, your work, your economic, everything. And you were just stuck mentally and physically and didn't have any outlet. And you even agreed on a surgery that was very difficult.
And unnecessary. The surgery was unnecessary. I could have had UFE through you. But nobody mentioned that to me, and I never heard of it, and I was terrified from the symptoms. I just wanted to get rid of it. I made a fast decision, and I wish I waited. Can we speak a little more on mental health? Because once after the fact, after I went through the process of fibroids and stepping away from everybody, I realized I went through my own state of depression. I literally disconnected from my family, my friends. I stopped dating. I stayed inside. And that was because I was embarrassed of a possible accident. I had a few accidents out in public. My menstrual just came out of nowhere, and it came hard. So when things like that happen, you become embarrassed. You close off. You shut down. And when I fainted, she mentioned that she fainted, but I fainted as well. And I have a gash in my head because I guess my hemoglobin was off. I didn't understand what was going on. All I know is I got up, I fell, and I busted my head. That's when I'm like, okay, it's time to go to the hospital. But why wait until it gets to that point? We need to make sure that women are aware of all symptoms. I'm so glad you mentioned that about miscarriages, but we need to make sure they're aware of all symptoms so they can specifically go in to get checked on fibroids, because if you wait, there's a possibility you will be in my position with minimum options. I wanted to ask her, which I don't know how she was disconnected, why the myomectomy instead of a hysterectomy. I chose a hysterectomy, but she chose a myomectomy. And
Shay, I was just going to say one thing before Kim comes on, is about the emotional, mental aspect of this disease. I think one of the greatest things that we've implemented at the USA Fibroid Centers is a quality of life score that we have every patient fill out on their initial visit. And there are questions like, how bad does bleeding affect your life on a scale of 1 to 5? How does it make you feel about going out or not going out? Are you worried? You have anxiety that you're going to have an accident? And inevitably, our patients are so often 5s across the board, 5, 5, 4, 4, 4, 5, and even though we can do a lot of scientific stuff, Dr. Yana and I could talk about the size of the particles and anatomical variations and all this stuff we can discuss. But what's so impactful is that at 3 months or at 6 months later, the lady I saw earlier today, we asked them the same questions again. And just recently in the last week or two, I've seen a handful of my patients who are now 6 months out, and they're all down to 1s and 2s. And you can hear it, you can see it, and we even can quantitate it and show that there's a dramatic and significant difference in how you feel about yourself, how you feel about participating in society, which is so immense. It's so immense. And until you look at these QOL, these quality of life questionnaires, and you don't realize how many things are affecting these women's lives. And it's a tragedy, a real tragedy, that the care is delayed, people aren't informed. It's really, it breaks my heart that to this day we have this amazing procedure that can help so many women, and not enough women know about it. So that's why this event is so fantastic. I'm glad we're doing it. I see that our number of viewers are doubling and tripling each week. So I guess we're doing something right. And so I just wanted to say it's really amazing that we're doing all this.
So Dr. Shyla, I want to ask you to tell this story on New Year Eve that someone came with low hemoglobin, because it seems like we have another theme here going on, that you need to faint or bump your head or really get really physical with your disease to realize that maybe something is abnormal. So Dr. Shiloh saved someone's life on December 31st. Tell us the story.
Yeah. Yes. I think we did this lady a lot of good, and a lot comes from the way we have our system set up. But like he mentioned, on the day before New Year's Eve, on the 30th, I saw a woman with her husband, and she just didn't look right. She came with fibroids, heavy bleeding. I could tell that she was severely anemic. So then all of a sudden, when you start talking about it, oh, I can't get up a flight of stairs, I get short of breath, all this stuff. So I looked under her eye. You could see it was really white, which is a big, a clinical indicator of anemia. I sent her get labs, and they come back that her hemoglobin is 3. So that was on New Year's Eve. And never a good time. There's never a bad time to make the right decision, right? So I called her up. I said, your hemoglobin's 3. You need to get to the hospital emergently because you could die. So she went. She got a couple blood transfusions because that's what we could do. And then 2 days later, on that Monday, I embolized her uterus, and she stopped bleeding immediately. And I just saw her recently, and her hemoglobin was like 11, at the low normal range, but still so much of a dramatic improvement. She's told me she's going back to nursing school because she's so affected by this. And it's just dramatic. I just did what I do, which is, provide the proper care for people. And thank God it worked out okay for this particular lady. And it was very dramatic.
Good for you.
Dr. Charlotte, it's a great example of how turning off the faucet of this bleeding normalize everything. There's nothing wrong with the woman except one particular portion, that fibroids irritate the uterus in all this area so much that she bleeds almost to death. And trust me, people die from this, especially Jehovah's Witness. People die, nobody even talk about this. So how do we fix problem without surgery? And the way it's done is inserting 1 millimeter catheter through groin or through even hand, wrist. And this long catheter goes to the origin of the artery, blood vessel that feeds fibroids. And that's embolize. Embolize is another word for clogging. It stops, like turn off the faucet that feeds this area, and fibroids just die out. Like a plant without watering, it just dies out and gets absorbed by the body. And it's very, very quickly, we see it. Women become much better within a few days. It's actually immediate, but maybe 2 or 3 days they have a cramping that prevents them from feeling great. And after that, they feel incredible improvement. And a few months later, on ultrasound MRI, we feel that tumors, fibroid tumors, just shrink, and disappear. Is that right, Dr. Charlotte? That's your experience?
I have a question with UFE. So are you cutting blood supply to the tumor? Is that what it is?
Yes.
So
I can answer the question that Dr. Yan asked and what you asked, Shay. So we navigate the small catheter. Today I did a couple of cases right through this little spot here in the wrist. It's pretty amazing. They leave with a little Band-Aid on and all the way down. And then if you go into the artery, you send in little plastic particles. They're inert, but what they do is they clog up the artery, like clogging up a sink or a toilet, okay? And then what that does is the fibroids no longer get oxygen, glucose, and other nutrients, and they die. And then, so they are blocking the artery directly feeding the fibroid. And the beautiful thing actually is, everyone hears counting fibroids, 1 fibroid. I hear comments, see comments, 2. I went from 3 to 4. I bet that many people who go from 3 to 4 actually went from 3 to 10 or 20, because when you get these imaging studies, you see a lot of subtle fibroids. And the beautiful thing about UFE versus myomectomy is that it doesn't matter whether you have 1 fibroid, 2 fibroids, 10 or 30 or 50, it makes no difference. They all get treated. With a myomectomy, you have a few that are removed, 1 or 2 or a couple. How do you know which one's the offending agent, in fact? So in UFE, all fibroids get treated. The left side and the right side, it's all done at once. They all shrink up, like Dr. Jan said, like taking a grape and turning it into a little shriveled up raisin. Sometimes they disappear, but the bottom line, people are asymptomatic or much bleeding within their first cycle.
And I have a few questions that I just want to just kind of follow up with Dr. Jan and Dr. Shiloh. I've been seeing a lot of comments from women on here who are who have received the uterine fibroid embolization, and they've said that they have seen fibroids to return. Can you please talk a little bit about how our bodies are very different and some of the reasons why they could return, and some of the things that you suggest for that woman who is still dealing with this issue?
I'll take this question.
Okay.
So we've done research in our organization on more than 4,000 recently performed fibroid embolization. And we'll look at this, and we discovered that in our hands is a 1.2%, so 1.2% of fibroids that comes back and require repeat fibroid embolization within few years. So so that means 99% very, very good, excellent result. And we started looking why. You understand that if you do something many times, you become better and your result is getting better. So when there's a studies about fibroids, when in certain hospitals, they do maybe 3 a month or 25 a year versus 10 a day. But some of our doctors, you understand, whoever does it many times a day, every day, or many 10, 20 every week, they're so much better than someone who does it 2 or 3 times a year or a month. So getting better into this, personally, each doctor is one thing. Second, very systematic approach and following the standards that everything is done right gets us very predictable, amazing outcomes. And we actually got approvals from research committee for 2 studies that we want to show our results. One study going backwards that we'll publish that exactly describes how in dedicated organization, dedicated clinics or institution, you can achieve incredible success. And the second thing, going forward, track every woman who come to us objectively, quality of life objectively, and see how it's done, and publish this. Because we know in a myomectomy, as Dr. Shiloh explained, and Shay mentioned, it's a surgery. You think about like you're doing fillets, like a steak. You open and you try to remove some fibroids from the surface of the uterus, but you see what you see with your eyes. You don't see, and it's basically like, butchering, like a meat from the meat. And that's why within 3 to 5 years, more than 50% recurrence. And a fibroid, you can have, from what we've seen in our organization, 99% great, phenomenal long-term results. So for the woman that still suffers from fibroid after UFE, I suggest to call us and let Dr. Shiloh, other doctors, depends where she lives, evaluate and see what can be done. The beautiful thing is we can still go with a catheter and check with MRI, ultrasound, go with catheter and fix what's left to be fixed some other place.
This is awesome. I wanted to just, and I'm sorry to cut you off, Shay, because there's something that I want to ask you, because I want you to be part of this, this challenge.
Specifically about UFE that I know a lot of women want to know. After UFE, how often does the fibroids come back? Meaning, do they constantly come back for another procedure? Like, how many procedures do we have to have? Or is it like fibroids, they come back and we might have to have a myomectomy or hysterectomy again?
I'll take
so what
that.
is the
I don't have the data. Dr. Yan was talking briefly a moment ago about the data that USA Fibroid Centers have.
Yeah.
I've been doing this for 20 years, and in 20 years, hundreds, if not 1,000 of fibroid embolizations. I've only had one patient return for a UFE. Now, again, there are many reasons for that. Potentially, you have it when you're 40 and then you move and live in another town, so I wouldn't know about it. But in general, it's pretty rare. And I think it's also age specific. So a woman who is 48 years old, who's perimenopausal, who has big fibroids, should absolutely avoid a hysterectomy. One of the things we need to talk about is that hysterectomy has been shown, these are papers published in the New England Journal of Medicine and JAMA, to increase your risk of heart disease and increase your risk of breast cancer. I mean, that is something no one tells you. We're going to take your uterus out. It's no big deal. Why don't you forget about worrying 20 years from now that you might get heart disease? So, the bottom line is if you're close to menopause, 45, 46, 47, the fibroids are not coming back. No chance, okay? Now, if you talk about a 35-year-old woman who has another 15, 16, 17 years ahead of her, look, it's possible they're going to recur. But as Dr. Yan said, it's certainly possible to go back in again and repeat the procedure. And when it's done by people like myself and the excellent other doctors at USA Fibroid Centers, when we're doing multiple fibroids a day, there's a procedure that's done in 30 minutes to an hour with sedation. You feel great. You have a little pain afterwards. That's it. You leave with a little. I mean, I'm sorry I can't show you pictures, but I saw a patient today. I couldn't even see. I literally couldn't see where I went in on her arm. And for that reason, you have nothing to lose. Really, it's just an amazing procedure, and there's really no reason to delay it or to or not even consider it. I mean, it has to be done, and the risk of fibroids recurring is extremely low, and just probably a bit of age-dependent, fibroid-specific, et cetera. So,
Does the size of the fibroids, as far as using UFE as an option, what if it's a huge tumor? Is that still an option, UFE?
Well, we assess every patient. They're all individuals. So, it's hard to say. It used to be that people used 20 centimeters of a uterus as a cutoff, and 20 centimeters is enormous. That's a 5-month pregnancy. That's above your belly button, okay? Now, I've kind of pushed the limit personally to 25 centimeters. I mean, you have to look at all the findings and make sure that you think it's safe. So then, people do fibroids that are 10 centimeters, 15 centimeters. What if you have a single 10-centimeter fibroid? Today I saw a patient, again, a single fibroid about 8 centimeters size, and that's no big deal. She's going to do great. So, there's a point where we say maybe it's a little too big, but that's so uncommon. I mean, up to 25 centimeters, you're talking almost up to here. And I think under those circumstances, we can treat 99% of people. But I would say, why wait till your fibroid gets that big? Like, it's shocking to me at times that women have been forced to wait till it gets up to their, above their belly button to seek attention. Come early.
In an environment where we don't talk about it, love. No one speaks of menstrual cycles. We're raised to keep it quiet. When you're on your menstruals, wrap up your napkins. You have any issues with your menstruals? We were never taught about fibroids, what to do if our symptoms are greater than what they're normally supposed to be. No one said anything. So you can't be in shock. You have to get over that shock factor and help us get through it. What we're doing now is up and speaking out on the issue so this shock factor can be non-existent. You can't that wow factor. I'm saying that because when I went to speak to my doctor, she was so rude and disrespectful to me. She made it seem like I was just another patient with fibroids, as if I'm supposed to just know what that is. You deal with it constantly. I've never heard of it, and I'm a woman. You will never have fibroids. You're a man. But as a woman, I've never heard of this. So instead of having that shock factor, I think it's just best to just guide us through it and give us an understanding and be more informative. Because it when you talk like that, it puts people away. I'm telling you, it does. It really does.
That wasn't really what I intended, honestly. And I apologize if that upset you. It really wasn't what I meant. What I meant is that it saddens me more than anything else that because of what you're saying, that it takes that to be that large before someone has the courage or ability to seek somebody out. And it's also because people do ask their gynecologist over and over and over again if something can be done, and they're told no, or your option is to have your uterus taken out. So it's not, what I'm saying is it's upsetting to me, honestly, that it has to get to that point before someone is able to seek care. That's all. I mean, it's really, it's a testament to the failure of medical systems to allow women to get earlier.
Yes, absolutely. It is a failure of the medical system. We'll let her take over because I know she had a lot of questions she wanted to ask you guys, but that was just something I really wanted to speak on, and that's all I have for right now. So go ahead and take it over, girl. You're the host.
Well, thank you. I'm glad you spoke your piece, and the reality is that, you know, it's our bodies, and, you know, women are upset and they're frustrated, and I want you guys to know that the doctors are here to help. They're here to offer, you know, encouragement, enlightenment, and to enlighten you about some of your options, to give you information. Information is power. And a lot of times, because we've sat in silence and perhaps we've gone to doctors who have not had our best interests at heart, like in the instance of Shay, and many of you who are on here, because I'm reading your comments, like I'm looking at my iPad, I'm looking at my phone, and the comments are coming so quickly, it'll blow your mind. But many people are talking about it coming back, not being educated about what their options were, you know, resorting to, you know, hysterectomies because they didn't know about UFE. You know, there's a fear of getting UFE and them coming back. The reality is that our bodies have been through so much because of doctors who have not been like the two of you. Okay. And a lot of times it's choices. People are saying, you know, you shouldn't eat certain things. Why is it that African-American women are getting this? You should be eating this. You shouldn't be doing that. I want you all, the doctors, to really just kind of touch upon how different our bodies are. Because what happens to Shay might not happen to me, might not happen to many of the ladies who are on this live. And I understand that women are speaking up. I want you all to speak up. I want you all to share, because this is called Talk About You, your uterus. It's your uterus. We don't want you to be silent. If you're angry, if you're frustrated, if you're lost, if you don't know what to do next, I encourage you today. And I've seen many of you ask questions about, how do I get in touch with the USA Fibroid Center? I challenge you to channel that frustration, to channel that anger, and to take your mouth and your fingers and use it. Go to the USA Fibroid Centers, make a consultation, set an appointment, and get some information about you, your uterus, your life, your health. Because what my story was and what Shay's story was may be very different from your story. Dr. Yan, I want you to just talk a little bit about if you're able to conceive after having the UFE procedure, or Dr. Shiloh, whichever one of you can take that question, because I've seen that question come up about 12 times in the last 5 minutes.
So uterine fibroid embolization is fertility-friendly procedure. Fertility-friendly. When we close blood supply to fibroids, there's a plenty of blood supply for the uterus to feed the baby. Other thing is, when fibroids are shrinking and stop pushing a baby inside, then a decreased risk of miscarriages. So it's an amazing procedure, and there are many studies showing that it has a great outcome, and many women get pregnant, and it's very much one of the first lines of treatment that needs to be done. What's the alternative? Alternative of myomectomy, that after that they will come back 50%. Alternative hysterectomy, then forget it. There's no more no more babies at all. What's shocking is that, and that's why probably Dr. Shiloh sees so many women with the huge fibroids, that when we ask, a few years ago, we started asking our patients whether they've ever been recommended UFE. The answer is no. Nobody ever knew about UFE until they came to us. Seems like like everyone is hiding this particular treatment and option, and women suffer in silence, don't speak to each other, and just massive suffering that completely ruined the best decades of women's life. And we want to empower women to know about different options, make the right choices, and stop suffering. If you have a crooked teeth, like many people do, in the middle school, they go and fix them. So to have the best options for their life to have the best smile. And it just very much, we associate good opportunities in life with the dental care. And it's covered by Medicaid, all insurance. What we don't understand, that nobody talks about this, that suffering from fibroids hit women physically, mentally, economically, socially, destroys a family life, and basically leads to losing babies. And nobody talks about this. No one. And that's what we started, the Fibroid Fighters organization, supporting Fibroid Research and Education Act that was proposed in our Senate and Congress. And thank you, Lady, for being our Fibroid ambassadors to bring awareness and empower women, stop suffering in silence, not normalize abnormal menstrual period, and then get help they deserve very early.
And so as we're talking about this help that's offered, tell us the difference between a UFE and a myomectomy. Many people are asking about the myomectomy versus the UFE. What's the pros and cons of each as they are, attempting to resolve these issues that they're having with their fibroids?
So in reality, there was a study that showed what's the biggest differentiation whether people get myomectomy and fibroids. And there was no physical differentiation, but there was one risk factor for women to get myomectomy. Ask advice from gynecologists. So if you, go to Target, nobody will send you to Walmart, right? And gynecologists do two procedures, basically, in different variants. It's either myomectomy or hysterectomy. Myomectomy, just let you know, it's an invasive procedure. It's a major procedure that's done under general anesthesia that women cut open and it surgically remove fibroids, whatever eye can see. And it's a days of recovery or weeks in recovery. And after that, 50% chance that they will come back within a few years. For second, I don't know why would I even consider this. I don't know. Why would women consider that? Only if she doesn't know that there's an opportunity for to first look and see what the fibroid embolization is for her. And fibroid embolization is in the office, can be done outpatient. Not everyone does it outpatient, but we do. It takes 30 to 40 minutes. We had the shortest 20 minutes procedure under very light sedation that you can have not incisions in the belly, but a hole like a blood, a sample taken in the wrist that Dr. Schuyler didn't even see a few days later, or in the groin. Go ahead.
I see a lot of questions and women are asking, can you have a child after UFE? Because
yes, and I know they're rotating.
A doctor told here that if she had a UFE, there's a possibility she cannot have children. So can you clarify that? How that?
Answer that.
I can speak to an actual real study. So, we can talk about anecdotal experiences and someone can say whatever they want, but there was a study published 2 years ago in one of our major journals. It looked at 359 women who were infertile, who went on to have UFE. And of those women, about 40% subsequently went on to become pregnant. So fertility and infertility is not one size fits all. There are other issues, of course, but it's clear that that study demonstrated that at least 40% of those 359 conceived. There are also studies that have shown there's no higher rate of birth defects. So, I mean, look, you can say whatever you want, but there are some legitimate studies out there that shows that it's perfectly reasonable, and many women who had the procedure are able to subsequently conceive. Many women who couldn't have a baby can. And so it's, for that purpose, it's definitely a viable alternative that will not absolutely be fertile. The only other issue that maybe this speaks to is there's this, rare problem called premature ovarian failure. So if we inadvertently or embolize both ovaries, some women can go into menopause. And, we have to talk about the realities. And the reality, though, is that it's a very low percentage. At age 40, the risk is about 1%. And so, again, my personal experience, I've never seen it happen. So that may be another potential reason why some doctor might scare you and say, well, that's that. You can't have it because they're going to take your ovaries out, and that's going to be it. But in general, it can be done, and it does not cause you to not be able to have children.
Since this procedure works so well, why aren't the doctors offering this procedure, and why is the option mostly myomectomy? Why is that?
Depends which doctors you ask. If you ask
I
gynecologists, they don't do it. You ask 4 gynecologists, right?
I spoke to 3 different gynecologists because I didn't want to have a surgery. I was terrified, but a UFE was not an option. Neither one of them mentioned UFE to me.
I think you need to ask gynecologists why didn't they mention. They definitely know about this. Definitely know. It's a very serious question. And you need to ask them why they don't and I think my theory, unfortunately, if you come to Target, they don't send you to Walmart. And that's but you need to ask them. It's very, very important thing. And you know, if you ask doctor in your hands, what is better for me, you know, what do you suggest? And doctor need to say, I think you'll better served by someone else's hands, you know, for please consider this. And it just doesn't happen.
Another that I use also, it may resonate with you, is that, let's say 30 years ago, everyone who had heart disease would end up with a CABG, a coronary artery bypass graft. You know, my friend had a quadruple bypass, whatever, right? That's, everybody had it, okay? That's the standard of care 30 years ago. Now, fast forward to 2021, it's a very small percentage, maybe 5 or 10% who need a CABG, and 90% are treated percutaneously with an access from the wrist or the groin by cardiologists that put stents in the heart. This should be the same thing. The vast majority of fibroid patients could easily be treated with this procedure, and the rare few who, for whatever reason, would then need open surgery. That's it. That's how it really should be. The fact that we haven't migrated to this is simply because, as he pointed out, the gynecologists don't perform the procedure. The cardiologists and the cardiothoracic surgeons have worked together, and now they have the best plans. Here, it doesn't work that way. So that's where we should be. That's where we should be. And hopefully,
So
more of this.
UFE too cheap, because it seems like it's coming down to money. Is that what it is? Is UFE too cheap? Is that why the doctors won't, you know, present the option to you, because it's more expensive to do a myomectomy or a hysterectomy? Is that the problem? Is it all politics? Because it still doesn't make any sense why that wouldn't be an option. You can do myomectomy and hysterectomy at any hospital. Why you can't do UFE at any hospital as well? Why is that not a constant? It still doesn't make sense to me unless it's pertaining to money. Speaking of that, does insurance cover UFE? Health insurance?
It does, including Medicaids. It's covered by insurance, but it's a lack of education about the options. And we already look at this lack of health education in many aspects of understanding what's normal, what's abnormal, normalization of abnormal of disease, because it's so common. Lack of understanding of pathology or of options of treatment, not knowing where to turn, who to call, how to get the right care, not understanding the coverage by insurance. It's very complicated, but can be very simple.
What if I don't, for those on here, what if someone doesn't have health insurance? What are the options then if we want to go with UFE?
I think UFE will be much cheaper than anything else because you can do it in the office. You don't go to the hospital. I mean, by factor of multiple, cheaper than anything else.
For the people, by the way, I want to clarify one thing. For the many people, I understand there are various types of insurances, and we take many of them. And sometimes it comes up, it says, we don't take your insurance. I'm going to tell you what's actually the truth. Many insurances don't take us, because if I accepted all these various insurances, that would mean that those patients would have access to doctors like myself and other doctors. And so rather than, they're just restricting access to their own patients. It's not that I won't take it if I could. I've asked several insurances in my Philadelphia local region that have, you know, maybe lower income insurance. They won't put me on their panel. That period end. And that's just because they don't want their patients to come to us. They want, you know, that's it. Sorry, he's not on our panel. You can't accept it. It's shame. It's very sad. But truthfully, I see patients oftentimes as a free consult. I do telemedicine visits. I see them for free. At least I can offer them some advice. And if that's the case, you know, as far as costs are concerned, you know, sometimes we have patients who are able to pay a little bit in cash, and there's other credit and other options for people that they can obtain that can help them pay for the procedure. But as Dr. Jan said, by an order of magnitude, it's less expensive than having a hysterectomy or myomectomy in the hospital with a hospitalization, overnight stay, anesthesia, OR time. You're talking about $40,000, $50,000, $60,000. When you talk about what we do, it's a much lower cost because it's in and out in one day. And so, you know, even for people who have a difficulty affording it, I think it would potentially still be an option. And we try our best to help. I promise. I promise see patients every day that can't afford it, and we do a free screening or free ultrasound. At least I can tell them what's going on and educate them a little bit. I mean, that's the most that I can do.
Yeah, I think that that's really the whole key to the whole conversation. And I realize, I feel like, you know, people are very sensitive about this subject, and rightfully so, because these are reproductive organs. This is the soul of us as a woman. I mean, this is the way, you know, we feel, we love, we express, we have children. You know, so many women are not able to have sex because their sex drive, you know, is lost. And, you know, so there are a lot of things that are affected by fibroid disease. So ladies, you know, instead of us assuming, and I'm going to say this very bluntly, but very confidently, instead of you all assuming and taking the advice of those that are on the chat, I advise you to call the USA Fibroid Center and get a consultation. It will alleviate the fear just by knowing. A lot of times what we assume is what we're afraid of. It's what we think. It's what other people have been through. It's what other people have told you. And unfortunately, we fail to educate ourselves about ourselves because we won't go to the doctor and hear about ourselves. Get another opinion. I don't care if 3 other doctors told you what was said. Get a 4th opinion. Go back again, check again, try again. And I wouldn't be standing here and advocating for anybody if I didn't believe in the process, if I didn't believe in, you know, this service that they're offering, this USA Fibroid Center. I wouldn't be on here. I'm definitely one that I'm going to speak what's truth and what's right. And so if you are interested in finding out more about your body, I'm glad that you all are, you know, are expressing yourselves and really just advocating for one another, telling one another what they should do. But the reality is you won't know unless you find out for yourself. So just make that as part of your list of things to do tomorrow. We all have a list of goals. We all are women. We always say we're bosses and we're doing all this stuff, but we're not the bosses of our physical body. We're the bosses of children, our relationships, our businesses, and everything else. So boss up with your health. Boss up with that. And just make a phone call. It's just as simple as that. Make the phone call, get the appointment, get the consultation, and find out. If your insurance is not accepted, there's other ways to pay. It's just a matter of how important is it to you, you know, how much are you able to go out there and find out. We can find out everything else about anything else, from us going to school to buying houses and anything else. We're resourceful people. Women, we're resourceful. That's the way God made us. So we have to utilize our resources. We're bringing them to you. And I hope that in the process of us bringing you this information, what you do with it is up to you. And so my goal, and I come to you in love, is to just find out. Just find out for yourself. Your story may never be my story. I pray none of you ever pass out. I pray none of you ever suffer with 14 tumors. I pray none of you ever bleed through pad after pad, clothes, and be embarrassed. I pray none of you ever have to go through that. I pray none of you ever have miscarriages and never have a portion of your life where you're infertile. I pray that never is your story. But if it is your story, we hope that we have some answers for you. So I want to talk a little bit before we close out. I just want to just talk a little bit with the doctors about some of the options that you all offer when a person does call into the center. What does that phone call look like? what happens once they call in, once they realize I do have some symptoms, I got some heavy bleeding. I heard Shay, she was, say this. I heard Dr. Kim say that. But what once they make that phone call, what happens next?
So during the phone call, our very knowledgeable specialist will answer the phone call and ask patient about the situation, about the location, about the insurance, and matched with the closest available interventional radiologist that works in the area, and they will try to schedule an appointment within 1 to 3 days. And we'll try to make it as optimum for the time and cost for the patient. If there are any insurances or no insurances that the patients don't know have an issue, our specialists will be able to even suggest them where to go online and apply for insurance. So scheduling is very, very simple. The same way, exactly the same way, women can schedule appointment if they go online to usafibroidcenters.com, usafibroidcenters.com, and there's online scheduling. When they go online schedule, they basically see exactly the same question the call center representatives will ask them over the phone. It's the first name, last name, insurance, location, and photographs of your insurance card, driver's license, and boom, as a miracle, they have exactly time and locations or few options that are available for them.
How
And
many
choose.
have? Tell them about the different locations you have.
So we have about 40 locations that have interventional radiology office-based labs that in different states from coast to coast, and there will, in New York alone, I think we have maybe 25 locations in New York City and neighboring counties. So I don't think it will be very difficult at all. And when they come for appointment, those women will have a very easy experience of coming, checking. The doctors will talk to them. They will have ultrasound right away, that either transvaginal or transabdominal, that will objectively be able to confirm the diagnosis. In various cases, we'll send it for MRI and will help to schedule appointment right away. We'll take the blood if needed. We'll do endometrial biopsy. We'll do everything needed to be one-stop shop and immediately get answers on all the questions. Not like some doctors that first see you, then send you in different place for blood work, then a third place for ultrasound, then fourth time that you need to go to them to discuss the result, and then something else. We try to combine everything because we know everyone is busy. Right. Nobody has time to waste, and why would we procrastinate, prolong suffering? So right away we'll do that, and at the end of the appointment we'll explain all the options that's available, that's possible, the best for the woman, and schedule her for a treatment if needed. And during this time, between the time of appointment, time of the treatment, we'll get approval from insurance. So basically when they come back, everything already, all treatments are pre-approved by insurance. So one-stop shop.
Okay.
Awesome.
So asking in the comments, okay, you got a website and they have a list of all of the different locations, and you'll find out which one is closest and nearest to you. So that I had to answer that because it was a lot of questions about the locations.
We also have a Fibroid Fighters, non-for-profit organization that dedicated to patients' education. And please go to fibroidfighters.org. And I think that would be awesome if you understand that how common is the problem, how severe is it, and how women underserved and underhelped. Just talk with your friend, with your family, with your friends, with girlfriends, with your boyfriends about things. Spread awareness and tell everyone, not just suffer in silence, but look for option. As Kim said, be resourceful. Like you're resourceful with everything else except your own body.
Yeah, that was a good one.
Yeah, it's factual. And I just want, before we close out, for those that are just logging on again, I'm Dr. Kimberly King. I'm one of the fibroid ambassadors. We have Shay Johnson. She's also a fibroid ambassador. Dr. Yan, Dr. Shiloh, they're both here. We have, board certified professionals who are here. They're licensed practitioners. They are licensed. They're not just telling you something on a group chat. influencers. They're not, social media, hot boxes. They have a doctorate in these particular fields. This is what they specialize in, and they're here to help. And so I'm really just stressing, and I can't stress this enough, and I see this all the time on chats where people really follow, and it's no offense to influencers, because I think people who influence you, it's great if they're influencing you to do the right thing. It's only when they're influencing you by their emotions and by what they feel and what they think versus fact that it becomes problematic for me. And so I'm glad that I'm able to get on here. I'm speaking to you from firsthand experience. I'm not speaking to you third hand. I'm not speaking to you from what I heard. I'm letting you know exactly what I've experienced as a person who suffered from fibroid disease and was unaware that I had something that was considered to be a disease because I listened to myself and I did not listen to my body. My body was talking, but I wasn't listening. My body was ailing and aching. My body was breaking down, and I wasn't listening to my body. And so that's what I want you all to listen to. The facts don't lie. Dr. Yan, Dr. Shiloh, please tell us one more time, for those who may have just jumped on, what are some of the symptoms? Because I want to make sure we stay on point, because each week we're having these conversations. So ladies, I invite you to come on and to share each week. But this week in particular, we wanted to talk about the symptoms of fibroid. How do you know you have them? I want you all to be aware of them. What does this little, I call them little demons, because that's what they look like to me when I looked them up online. I was like, oh my God, this thing looks like it got fangs. It looks like it's growing. Like, what is this thing? Like, this thing is the worst. And I want you all to tell Dr. Shiloh and Dr. Yan, that's my little name for these little demons. What does a fibroid look like inside you? What do you feel? How will a woman know? Why should they call? And either one of you can answer that.
Go ahead, Dr. Shiloh.
Well, thank you. And I'm glad to be here and be able to continue to educate people about this problem. And it's, the symptoms are extremely common, but most commonly, we see the heavy bleeding. And on top of that, because of the size of them, we see the things that we've been discussing here before. Pressure on your bladder so that you have to pee a lot. Pressure on your colon so you get constipated. As you mentioned, painful intercourse. And other things. I've had patients who've had leg pain running down their leg. I had a patient who was a pilot, a female pilot, who was developing pain down her leg. It was so incapacitating that she was unable to do her work as a pilot because her leg was getting problematic with the pain. And it was because a fibroid was pushing on a nerve in her pelvis. And within a week or two of the procedure, when the fibroid began to shrink, the pressure on the nerve was relieved and she was able to, work again. So there are a lot of symptoms. The primary ones, of course, bleeding, and then the bulk related symptoms that depending upon where the fibroid is, will determine whether it's pushing on your bladder, colon, other structures. And, that's where, we see the women complain the most.
And worst of all, miscarriages. So everyone who suffers from the symptoms of bleeding, of pressure, or infertility, please consider helping yourself and looking for information about fibroid disease. We'll be happy to help you if you schedule an appointment with us. But most importantly, help yourself, educate yourself, make the right choices. Don't just take any suggestions for granted. Learn about your body.
Well, thank you so much, Dr. Yan, Dr. Shiloh, and Shay. I think that we have covered all of our bases tonight. Everyone that has joined in tonight, I appreciate you all so much for your comments. I appreciate you for sharing your heart. This is a very sensitive topic, and certainly one that we have not, again, had openly at tables. I think my friends, and I can close out with Shay on this, but maybe we said, oh, I'm on my period, I don't feel good, but I don't think we really did the in-depth, the dive in and unpack like we've done tonight. And I think it's simply because we all had different doctors. We all do different things. Some of us are holistic. 3 of my friends are holistic. They have holistic practices, so they didn't eat certain things. And they say, well, I never had them because I never ate this. Or, some of my friends are from of other ethnicities. And they may say, I never had it because I'm not African American, and so there are lots of myths and stories and assumptions about the fibroid disease. The reality is this: if you're watching and you have any of these symptoms, regardless of your ethnicity, your religion, what you eat, what you don't eat, I encourage you to just call. I encourage you to call, make the phone call, make it a priority, and just seek the counseling. And then you can decide whether or not, once you know your options and once you are educated, again, Dr. Yon, tell us about the center where they can call in just for education again. Can you repeat that information?
So you can call, you can just go online, usafibroidcenters.com, usafibroidcenters.com, and there will be phone number to call, or you can choose online option to schedule appointment. Or for further information, you can go to fibroidfighters.org to learn more about fibroids, and also how to join us, become ambassador like Shay or Kim, and help to spread awareness, help others.
Thank you so much. Thank you, Dr. Yon. Shay, did you want to close out with anything? Do you have any tips that you can give anyone who may be suffering in silence?
Absolutely. There is no more silence. As I say all the time, it's time to speak up and speak out. And for those of you who have any additional questions, you can always reach out to me on social media. I am Shay Johnson. As I stated before, I have a health and wellness business. I sell detox, turmeric, moringa, but specifically fibroids. I had a personal experience with it. So again, reach out to me. I am Shay Johnson, and check out my website, thehealthyhand.com. That is thehealthyhand.com. We will continue to speak out on fibroids, and we hope that this conversation, even if it just helped one person, that's great, but we hope it helped many of you. So thank you for having me, and I appreciate you guys for talking to me.
Thank you very much. Thank you.
Thank you, Dr. Yon. Thank you, Dr. Shiloh. See you later, Shay. You guys have a good evening. Remember, you can inbox any of us. If you missed any of the links, if you missed the website, inbox us. I've answered lots of questions on our last chat last week. And hopefully you guys, if you have any other further questions, we can forward you right to the US Fibroid Centers. Thank you so much. Have a great evening, and we'll see you next week.
Be healthy. Yeah, bye-bye.